Imagine enjoying a dinner out with friends, only to find yourself feeling strangely intoxicated later on, even though you haven't had any alcohol. On your drive home, you get pulled over for a random alcohol screening and fail. This scenario isn't just a mix up, it's actually a rare condition known as Auto-Brewery syndrome. So, how does this all happen? Hi, this is BiteWise, and I'm here to cover the science behind health and nutrition. Today, we are deep diving into Auto-Brewery syndrome, or ABS. ABS is a rare gut fermentation syndrome where your gut microbes feast on carbohydrates to make intoxicating amounts of alcohol. The guilty microbes are the yeast Saccharomyces cerevisiae used in bread and alcohol production and various candida strains used in food processing, pharmaceuticals, and cosmetics. Other yeast and bacteria can be responsible for ABS, but the two mentioned are the main culprits. These microbes occur naturally in our gut and under healthy conditions only ferment a minute amount of alcohol. Your gut turns into a mini brewery when these microbes become overpopulated. This could happen due to prolonged antibiotic use, high carb and sugar diets, chronic conditions that affect the gut health like diabetes, Crohn's disease, and inflammatory bowel disease, surgeries that alter the structure or function of the digestive tract like gastric bypass surgery, and genetic predispositions. However, you may have none of these risk factors and still have ABS. Episodes of Auto-Brewery syndrome mimic the same symptoms of alcohol intoxications on a girl's night out, like breath smelling of alcohol, flushed skin, slurred speech, delayed reaction, trouble concentrating, and even feeling hungover the following days. These episodes can occur randomly, even 24 hours after eating. This can be deathly if it happens when you are driving and get yourself into a car crash or getting pulled over for a DUI, which can impact your criminal records and employment. Your body randomly decides when happy hour is, and you have to prepare for it. The first recorded case of Auto-Brewery syndrome was in 1948. Physicians in Mulago Hospital in Uganda were performing an abdominal surgery on a 5-year-old boy when they noticed a strong smell of alcohol. The boy later died, and no one, even a mortuary attendant who was an expert in recognizing post-mortem alcoholic odors, could identify the source of the smell. They theorized that the microbes ferment on the sweet potatoes that the boy had for dinner. Obviously, they weren't going to accuse a 5-year-old child of drinking alcohol. Since then, similar instances have been reported in not only children but adults of all sexes. However, only a dozen or so cases get reported each year, so finding someone with ABS is like finding a rare Pokemon. The most recent report of the syndrome was in June 2024. A 50-year-old woman who did not drink for religious reasons visited the emergency department multiple times for severe symptoms of alcohol intoxication. She was, unsurprisingly, diagnosed with alcohol intoxication and even involuntarily kept at the hospital for a psychiatric assessment under Ontario's Mental Health Act. Fortunately, a doctor at Mount Sinai Hospital in Toronto finally correctly diagnosed her with ABS, and she got the peace of mind she deserved. A few people have been able to get out of DUI charges by providing that they have ABS. With the rising awareness of gut health, worldwide use of alcohol, and social media, there's a chance that someone might see the condition as a get-out-of-jail-free card. However, I realize that it's not that easy to fabricate a medical condition because the courts are usually skeptical of such claims, and you must present documents to support your medical condition. Because of its rarity, there's little information about the condition in medical training or clinical guidelines, which often leads to underdiagnosis or misdiagnosis. Symptoms of ABS are nonspecific and can be attributed to other common conditions such as alcohol use, gastrointestinal or metabolic disorders, and even psychological disorders. Physicians must be thorough during the diagnostic stage. They start with a detailed inquiry into the patient's habits, diet, alcohol intake, antibiotic use, and overall health, including any unexplained intoxication episodes. Family history is also considered. A general physical examination allows them to look for signs of liver abnormalities, such as yellowing of the skin and whites of the eyes or visible red cluster of blood vessels that resemble a spider's web, as well as neurological symptoms that match with alcohol intoxication. Lab tests follow, including complete blood count, electrolyte balance, kidney function tests, liver function tests, endocrine function tests, and status of vitamin B1 and B12. A specialized test for ABS is the glucose challenge test, where you consume a glucose drink to see if your body will initiate happy hour. If you think that the lab test is done, think again, because they will order a microbiology test where you provide a stool sample to identify specific microbes that are present in your gut. They then expose the microbes to different medications to see which ones work best at stopping growth. After all those tests, the patient fills out a questionnaire for drug use and substance abuse to rule out other causes of the symptoms. Finally, once they have gathered as much information as possible, they can medically diagnose a person with Auto-Brewery syndrome and move on to the action plan. Treatment may involve managing acute alcohol intoxication, prescribing antifungals or antibiotics, or a combination of both based on the results of lab and microbiology tests. The patient can also take probiotic supplements to rebalance the gut flora, but the effect of this has yet been thoroughly studied. Management of Auto-Brewery syndrome focuses significantly on dietary changes, and a dietitian plays a crucial role. The main strategy involves a low-carb diet aimed at reducing food sources that fuel gut microbes to produce alcohol and promote microbial growth. Firstly, the diet limits high-starch foods such as tubers, corn, peas, legumes, squashes, root vegetables, grains, cereals, baked goods, and processed foods like crackers, chips, and snack bars. These vegetables and foods have a high starch content compared to leafy greens, cruciferous vegetables, bell peppers, cucumbers, asparagus, and many more. Secondly, reducing sugar intake is essential because gut microbes also ferment sugars. Examples of sugary foods are sugary snacks and desserts, sugary beverages, syrup, and honey, baked goods, and processed foods. Fruits also contain sugars, but it's recommended to include them in the diet because they provide a plethora of vitamins, minerals, antioxidants, and many more essential macro and micronutrients. So greens and fruits are still on the menu. Thirdly, incorporating high-protein foods such as lean meats, fish, eggs, legumes, nuts and seeds, milk and milk alternatives is important. Proteins break down at a slower rate compared to carbs, which provides a steady level of energy and makes you feel full longer than high-carb foods. This makes sense since you are cutting down on starches and sugars, which take up a majority of your diet and energy supply. Some of these protein sources will also provide you with healthy fats and support your energy level, satiety, and even support cognitive health and mental health. Lastly, eliminating alcohol consumption is straightforward in managing ABS symptoms. After about a month or two following a low-carb diet, starches and sugars can be gradually introduced into the diet in small increments to avoid triggering any episodes. This emphasizes the needs of a dietitian because it's difficult to eliminate or limit the consumption of foods or food groups as your diet is part of your overall health and habit. Given the complexity, the patient's care team will most likely involve a gastroenterologist, psychiatrist, and dietitian for effective management of this medical condition. Finally, we've reached the end of our deep dive into Auto-Brewery syndrome, and now it can be your new fun fact of the day. Please, please, please talk to a healthcare professional if you have any questions about your health instead of blindly listening to someone online. I'll see you in the next deep dive into another health and nutrition mystery. Until then, keep your gut happy and your spirits high. Goodbye!